Thank you everyone for your attendance today. My name is Nicole Orlino. I am an admissions officer here for the online programs of applied learning at Johns Hopkins University Bloomberg School of Public Health. Today we'll be discussing our population health management program. Joining us today will be Dr. Mark Bittle, Director of the Population Health Management Program, Hiren Prabhakar, one of our graduates of the program, and myself. My name is Nicole Orlino. I'm an admissions officer. I work with our team to assist students as they explore their options for continuing education. I am very excited to be presenting with these two today. Mark, I'll let you introduce yourself first.
Thank you, Nicole. Thanks for being here, everyone. My name is Mark Bittle. I am sort of the founding father, if you will, of the Population Health Program. I developed a curriculum about 4 years ago. We launched a program 3 years ago, and we're now happy to have our second cohort of alumni in the program. I got my doctorate here in the School of Public Health back in 2006. I'm a fellow in the College of the American College of Healthcare Executives. And in addition to being the program director for population health management, I also run the master's degree in health administration program in the school.
Thank you, Dr. Bittle. Hiren, if you'd like to introduce yourself.
Sure. Hi, everyone. My name is Hiren Prabhakar, and I'm a 2020 graduate of the Master of Applied Science and Population Health Management program at Johns Hopkins. I currently work at the Advocate Aurora Health with the Enterprise Pop Health Division as project manager. I'll go into a bit more detail further down in the presentation.
Perfect. Thank you, Mark and Hiren, for your introductions. To give everyone an idea of what we will be covering today, Mark will take us over the industry overview, really discussing why there was a need for the specific program, and to give you an idea of who the program is targeted towards. He will also be going over the program details and curriculum to give you an insight on what skill sets you'll gain and what sets our curriculum apart from other programs. Our program is fully online, so Mark will go over an idea of what online learning is like at Johns Hopkins University. He will also go on to discuss some of the program faculty, and we'll hand it over to Hiren so he can share his experiences as a student in one of our programs. As for myself, I will go into admissions requirements, tuition and financial aid, and details about the scholarship we offer. We will save time for a Q&A at the end, so please feel free as you listen to the presentation to type out any questions you have into the chat box, and we will cover those at the end with Hiren and Mark. Thank you so much for your time, and Mark, please feel free to start.
Great. Well, thanks again, Nicole. It's a pleasure to be here and talking about the Population Health Management Program. This quote from Joshua Sharfstein, who is an associate dean now in our School of Public Health, but was a former secretary at the Maryland Department of Health and Mental Hygiene, I think really lays the groundwork nicely for the vision that we had for this program, as I mentioned 4 years ago. He said that population health managers who draw upon public health tools will be the leaders of tomorrow's healthcare system. And that was precisely again, the vision that I had for this program. I spent 35 years in the healthcare industry and predominantly the ambulatory and physician practice environment. And so had a good amount of experience in the community-based healthcare delivery systems. And one of the things that I realized when I joined the faculty of the School of Public Health full-time about 5 years ago was that we in the healthcare industry didn't have a really good understanding of what population health meant, even though about 5 years ago, we were just starting to scratch the surface and talk about it in our healthcare systems. So I thought this would be a wonderful opportunity for me to draw upon that healthcare management experience and then integrate that with the public health tools that Dr. Sharfstein mentions. And I really look at this population health management program as building a bridge between the healthcare delivery system and the public health sector and bringing those two elements together into this educational program. And so why is that important? Well, of course, we know that our US healthcare system is siloed, it's fragmented, and as a result, it's very costly. And yet we see particularly as a result of the Affordable Care Act passage back in 2010, there is a significant shift for healthcare administrators, executives, leaders, clinicians to understand this shift from volume to value-based reimbursement models in which hospitals and providers are being placed more at risk for the outcomes of their patients. But I think it was pretty clear as many hospitals started to dig into transitioning from volume to value that many of the factors that influence or drive poor health are not within the ability of the hospital or health system to tackle by themselves. Much of what drives our health or poor health is happening well beyond the four walls of our institutions. And in particular, we need to think about how do we address the social determinants of health and not just be thinking about the episode of care as we had traditionally done. So again, population health management, from my perspective and the program perspective, is really bringing the best of what we do in healthcare in taking care of patients and trying to improve the outcomes of our patients that we treat and reduce the per capita spending. But it's also about bringing the public health tools that help us to be better partners and collaborators in addressing the social determinants of health. Next slide, please. So this notion of population health management is becoming more and more a discussion point for boards and health systems and payers and providers as a strategy to address social determinants. Institutions, healthcare institutions certainly have different definitions for population health and population health management. We look at it in two ways in our program. That of our attributed population, the patients that are already part of our care continuum in our health systems, and stratifying them and identifying how to bring targeted services to best meet their needs. But the other definition of population health, looking at it from a true population perspective, is broadening that definition to include everyone in a given community, not just the people who are our patients, but the people who may never have been a patient of ours yet, and really thinking about the entire population within that given area. So our program is designed, again, to bridge the two aspects of public health and healthcare delivery. It's an interdisciplinary program, which we think sets us up well to provide, I think, structured, evidence-based coursework to our students. We have individuals from not only health policy and management, international health, health behavior and society, School of Medicine. So all of these different disciplines are coming together within our curriculum, which I will share with you in just a minute, to provide a very transformational type of learning experience for our students, really to help you build a better understanding of what population health and population health management is as we think about moving towards a more value-driven, accountable care system. So as you can see at the bottom, the core functions of public health are on the left: assessment, policy development, and assurance. And then on the right is the triple aim, which we know very well in the healthcare industry. And again, our population health management program is really meant to be a bridge in bringing the best of both of those worlds together so that we can truly focus on improving health in our communities. Next slide, please. So this is our curriculum. We have two elements to our program. First is a graduate certificate. So if you just wanted to do the first year of our program, you could enroll and you would receive a certificate in population health management from the School of Public Health. The curriculum, as you can see, is broken up into 4 terms. We have 8-week terms in the School of Public Health. So term 1, term 2, term 3, and term 4, a total of 25 credits. So in first term, there are a few things that you have to do for the school in terms of academic and research ethics, but we offer 2 courses in first term: Essentials of Population Health Management, which gives you a broad overview of population health and population health management principles, But it also lays the foundation for the rest of the program. You'll touch upon many of the things that you will then dive deeper into as you go into individual courses throughout the program. The other course is Principles and Applications of Advanced Payment Models in Population Health. That course really focuses on how we can better use payment methodologies to leverage and improve outcomes as well as population health. Collective Impact, how to partner and be more effective at partnering and collaborating is a course in second term, as well as Accountable Care, Assessing Quality and Effectiveness. For those of us who work and have worked in healthcare organizations, we know all too well about our efforts to measure and monitor quality as well as patient safety. This course actually starts to take it a bit further out into the communities to say, how do we define quality? How do we measure population health as we think about more broadly this notion of population as a community? We provide health informatics course, intro to epidemiology, statistical concepts, so understanding biostatistics is very important, as well as then managing health across the continuum. So this final course in the first year is looking at managing health across a continuum, where, again, if you're in the healthcare industry, you know all too well that there are models for us to manage our patient populations as we start to stratify them, whether it's disease management, care management. This looks at contemporary models of managing care across a broader definition of that word continuum to include outside of the four walls of the hospital. So it looks at contemporary models, both from a disease prevention as well as a care management. And care management is really focused from the high risk, which we again know at the top of the health risk pyramid, but also at that very lowest level of the health risk pyramid of those at risk, but have not yet developed any type of an illness. So how do we prevent them from getting an illness in the first place? So that's our year one curriculum. Again, if you finish just that, you would receive a graduate certificate from the School of Public Health. Next slide, please. This shows you the full curriculum. So if you're going to enroll in the master's degree, the Master of Applied Science, which means you would complete the first year curriculum, which I just described, and then you would take the second year curriculum. Again, as you'll see, there are 4 terms in the second year, just like the first year. There are 2 courses per term in year 2, just like in year 1. And so if you enroll in the master's degree program, at the conclusion of year 1, you will automatically receive the certificate and then go on to complete the second year's curriculum. So you can see these are higher level courses that we provide in the second year. We look at concepts of high performance. So what does it mean to be a high performing organization as it pertains to population health? We have a health behavior course, improving health through health education and promotion. This comes from our health behavior and society colleagues. We have a course that's really looking at systems thinking. So organizing for public health, a systems approach, as you might imagine, trying to improve population health across a community is going to require a systematic approach to addressing the social determinants as opposed to more of a programmatic approach. This is going to require collaboration and sort of a big picture view of things. So we think a systems thinking course is very important. Also, in the second term, we offer a behavioral economics and risk course. Again, the idea here is, as we think back to the first term of the first year where I mentioned we teach a course about applied payment methodologies, this course on behavioral economics and risk really gets people to start thinking about how do we change behaviors, because so much of what we understand about poor health and social determinants is that much of it is driven by lifestyle choices. And so part of what we want to understand is how can we leverage what we understand about behavioral economics to create incentives, if you will, to facilitate behavior change. And it's not just the behavior change of providers, as we see with, risk-based contracts today, but the individuals themselves, the community members at large. How do we leverage what we understand about incentives to change their behaviors as well? We do a course on the built environment. Social determinants of health tell us that the environment within which you live, your zip code, as it were, has a great deal of influence on your health. And so a course on the built environment is really focused on how do we address issues like housing, safe neighborhoods, access to transportation, those factors, again, access to healthy foods, all of those factors are part of the environmental factors that influence health. And then we also look at value-based concepts of socially responsible leadership. So this is, of course, one of the courses that I teach in the program, and it focuses on what we need to know about leading effectively in a population health environment. And then the last term of the second year is our social and cultural basis for community and primary health. So this is taking a deeper dive and looking at how we can structure primary care in new and innovative ways to address the social and cultural issues, again, much of which are built into or embedded within the social determinants of health. And then finally is the integrative activity. This is the culminating event prior to graduation. It's a capstone for those of you who may be familiar with that term, but all graduate degree programs end in some culminating experience. In our case, we call it an integrative activity, and that happens in the last term of your last year. You'll note, again, there are 2 years of coursework in the master's degree, 2 courses per term. You do have the option of doing the program in 2 years. If you took 2 classes per term in year 1 and in year 2, you could graduate with a master's degree in 2 years. Or you could take 1 course per term and graduate with a master's degree in 4 years. So it is geared and structured for part-time students, recognizing that the vast majority of the people in our programs are working professionals in healthcare, and they're doing this on a part-time basis. So you have the ability to do it as quickly as 2 years, the master's degree. You can do the certificate in as quick as 1 year, or you could take 1 class a term and do the certificate in 2 years. So up to 4 years to do the master's degree. Next slide, please. So just as a review, the graduate certificate can be completed in as little as 1 academic year, which is 4 terms, or you can take up to 2 years to complete it. The master's degree can be completed in as little as 2 years or as much as 4 years. And again, that encompasses all the courses you would have to take, as well as your capstone at the end. I think one of the things about this program that I and all the colleagues that I've worked with to develop the courses within our curriculum is that this is really a skill-based type of program. Master of Applied Science, we emphasize that word applied in all of our courses. We want these courses to be something that working professionals value in terms of being able to go to work today, go to class. These are online classes, which I'll talk about in a second, but take, a course and be able to go back to work the next day and apply what you've learned. So we take great pride in the fact that these courses are very much applied. They are very practical in their approach. These are giving you not just the theory, but how the theory is actually being applied to the extent that these things are being applied out in the profession. So again, very much an experiential program for working professionals. It can be completed part-time, as I mentioned. It is 100% online. Online for us are recorded lectures, and then activities that students can work on both individually and in groups, real time. We also do have synchronous sessions, meaning we get online together with the students and the faculty are online together. So we do have the opportunity to engage. We have online office hours where you can engage with the faculty in real time. So it's not just, listen to a bunch of recordings, take a test at the end, and you're finished. This is truly a professionally focused but rigorous academic degree. We have built into our curriculum the idea of group learning. So again, we have great individuals, students who are in our program. You'll hear from one of them here in just a minute. But our students are working professionals. We have presidents of hospitals. We have, active working clinical professionals of all sorts: doctors, nurses, pharmacists, social work. We have public health professionals. So the idea here is that we want you to learn from us, of course, but we also think you're going to learn from each other's experiences. And so group learning is built into our pedagogy. We have peer assessment opportunities so that you can share your thoughts with each other. As I mentioned, this is very skills oriented. So projects, cases that you'll do in class are predicated on real life happenings. So again, the ability to take the knowledge that we provide and apply it is built into our coursework. And so our goal is really to develop the future leaders of population health management systems, to provide both public health and healthcare professionals with the tools and skills that they need to transition beyond the value-based care that we're working towards now, but into more of the population health sphere. Next slide. So there are any number of career paths, in population health. I think most healthcare systems are actively moving in the direction of population health and have created positions, not the least of which are vice presidents for population health. We have a vice president actually from Aurora, where Hiren is working. She teaches our first term class and payment courses. So we have people in the business who are teaching our courses. You could be a director of healthcare integration, director of community health operations, population health initiatives manager. I mean, there are all sorts of titles that have population health built into it. And again, our goal here is that we are looking at helping to provide healthcare professionals and public health professionals with the tools that they need to transition into this population health world. I have a quote there at the bottom that you can see in the blue box of this slide. It says, "I recently interviewed for a director social determinants of health position." So there's yet another position. And this was at a regional health information exchange. That's what HIE stands for. The person goes on to say, "I'm happy to share. I leaned on my population health knowledge, including using an assessment assignment example. I used my veteran suicide health education promotion intervention assignment." This came from one of the courses the student took, to demonstrate my competency. As part of her interview, "I want to thank you for building a strong skill-based program." And this comes from Jennifer, one of our current MAS students. So again, we are very proud to hear from our students, which I do all the time, that they were able to take something that they learned in class today and apply it tomorrow. And I think that's a really a tremendous selling point to our program. Next slide, please. So online teaching at the School of Public Health at Johns Hopkins is nothing new. We've been doing it for a long time. Our courses are developed to be very well organized, so students are able to access all the information that they need all in one place through our course learning management system. All the readings are there, your assignments are there, due dates are there. Everything is facilitated through our learning management system. Our faculty, again, are readily accessible. This is not an online course where you'll never hear from the faculty. We are constantly reaching out to our students. If we don't hear from you, for example, maybe you've had a busy week and haven't had a chance to listen in on to one of the lectures, or maybe you missed one of our synchronous live talks, we'll reach out to you because we care. We want to make sure that you're doing okay, particularly in this time of a pandemic. And so we're here to support you, work with you, and assure that you get the most out of your education. So, again, it's an online program, yes, but there is a significant amount of engagement with not only your fellow students, but also with the faculty. And that really does allow for us to have peer collaboration, have student-faculty engagement, all of which is supported through Zoom, which is now what we use for our synchronous sessions, or what we call live talks. There's a 24-hour, 7-day-a-week help desk. Again, this is, you're going to be online using recorded lectures and accessing our course learning management system. But should you have any technical issues at all, you can't access a reading, you can't get in through the internet, whatever the issues are, we do have a help desk that's available both online, but of course it's also via telephone, so that you can have your questions answered in real time. Faculty are always monitoring their courses, as well as the TAs that help them, to assure that if you're having questions or having any course related issues, we're there to help. But if you're having any technical, we also have help there as well. Next slide, please. So I'm going to, this will be my last slide, and then I'm going to happily turn it over to one of our alumni, Hiren, to talk about his experience. But I just wanted to, again, reiterate I think the importance of, one, how we've structured the program, it being an applied program, very practical in nature, but also rigorous and evidence-based and evidence-informed. I think the other key element of our program is our faculty. It's multidisciplinary. As I've said, we have faculty from many different departments within the School of Public Health, as well as other schools, such as the School of Nursing. About half of those that are listed on the program faculty list in front of you are actually working professionals, are in senior levels in various organizations and are engaged in day-to-day the workings of transitioning their own organizations into a population health model. This is a bit dated, the list of faculty that I have here. We actually have a few, not so much ones to come off, but more to add. So we, again, have people from different industries that are involved as well, and that have been in the field of healthcare for many years, like myself, who've transitioned to teaching full-time, others that are still, in the field part-time and teaching, full-time and teaching part-time. So again, at the bottom, you can see all the different departments that are covered from an interdisciplinary nature, but I would also point out that many of the individuals, David Baker, Teresa Bittle, Ash Davison is a practicing physician, Megan Priolo, who works for the Health Information Exchange here in Maryland, are all actively engaged in population health management on a daily basis. Okay, next slide. So it's a great pleasure for me. I'll pass it along now to Hiren, who is a recent graduate of the MAS program, so that he can share his experiences with you.
Thanks, Dr. Bittle. It's a privilege to be here and talk about my experience with the population health program. To start off, I'll give a brief overview of my background in healthcare, as well as what I do in my current position. And then I'll go more into my experience with the master's program and the various opportunities and benefits that I found that really defines this program. And finally, for those of you who will be starting this program next year, we'll go into a bit more about some of the factors that may enhance your experience even further, at least from my perspective. So a bit about myself. I started my career in Canada over 14 years ago. And since then, I've worked at various healthcare systems, both Canada as well as in the US, focused primarily on process transformation, project management, EMR implementations, and so on. But what was most interesting for me was that transition from Canada to the US, both as someone who's employed within the healthcare system, as well as a patient. So in many ways, that transition added depth to my perspective on healthcare in general, as well as population health. I currently work for the Enterprise Population Health Division of Advocate Aurora Health, or AAH as we call it, and it's spread across Illinois and Wisconsin, all the way from the greater Chicago area to northern Wisconsin. And our enterprise population health division manages care for over 1 million members under risk-based contracts. So in other words, patients who are under a plan that has some form of a value-based care arrangement as opposed to a traditional fee-for-service or volume-based payment structure. We also manage three Medicare shared savings accountable care organizations across Illinois and Wisconsin, with our Illinois MSSP ACO being one of the largest such ACOs in the nation, with about 120,000 beneficiaries. We follow a pluralistic model of clinical integration with a blend of both employed providers as well as clinically aligned providers. And in my current role as project manager for the division, I support and help lead initiatives for our ACO, our clinically integrated network, as well as some of the functions for our managed services organization. A few examples of some of the initiatives I'm involved in include supporting our providers in meeting macro requirements. We also help deploy strategies to help our aligned providers to better meet quality outcomes for value-based care plans. And most recently, we implemented enhanced workflows for our care transitions team to ensure the safe transition and monitoring of COVID-19 patients from our hospitals back into the community. I also work closely with the Advocate Aurora's corporate strategy team to help ensure that certain strategic initiatives at the system level are aligned with our pop health strategies. So that's me in a tiny nutshell. And next slide, please. So when I first started looking for a population health program back in early 2018, what struck me most was that there were very few such master's level programs in North America, barely even a handful. And on top of that, I was specifically looking for a virtual program since I did want to continue working while studying part-time. As Dr. Bittle mentioned, this goes back to what Dr. Bittle mentioned regarding a dearth of pop health related skill sets, even as recently as 5 years ago. Um, Obviously, the Johns Hopkins program stood out for me. We all know that Johns Hopkins, and particularly the Bloomberg School, is a world-renowned institution for public health research. But more than just that, I wanted to have the opportunity to learn from the extremely distinguished faculty members, and then be able to connect some of the latest research in the field, what we were doing at Advocate Aurora. Like Dr. Bittle mentioned, it's a Master of Applied Science. So it's about applying many of the concepts, many of the discussions to what we do in the real world. So that was extremely important for me as well. The course format included both lectures as well as live talks from industry experts and thought leaders. So for me personally, this was refreshing and illuminating because now I could really understand some of the fundamental ideas behind many initiatives I was involved at work. And beyond that, there were concepts and frameworks that I learned during class that I would then take back to work and discuss with our population health leaders. Yet another great part of my experience was collaborating with other students. I would say I learned almost as much from them as I did from the course. And my peers came from diverse backgrounds themselves. Some of them were experienced leaders from the payer side. We had physicians, we had nurses, we had students who had had extensive experience in international health, students who came from policy backgrounds. Some of them came from community-based organizations. So very diverse set of backgrounds. And I learned a lot from the teams that I was involved in as part of the different courses. So that to me was a great value add of the program, to learn from students and faculty and then to connect with them as well. Finally, my last 2 terms in the program coincided with the onset of the pandemic. And that was a strangely fascinating experience in and of itself, because a lot of what we had studied and written about up until that point suddenly came into acute and I would say sadly painful focus, because things like social determinants of health, health inequities, distribution of health outcomes within a population, all of that and more are even more relevant now than it's ever been. it's always been relevant, but now it's come into public focus. So I would say the value of population health and this program are even more important now than it was, say, 8 months ago. Next slide, please. So for those of you who will be taking this program next year, thought I'd share a few tips that might enhance your experience. First off, yes, it's a virtual program, and therefore it might be a bit easier to maintain a work-life balance. However, by that same token, it's equally and perhaps even more important to carve out time for your lectures, your assignments, your reading, your group work. Um, it's easy for life to take over. Um, Work can get busy, life can get busy. I got married during the second year of the program, so it's extremely important to allocate time for your coursework. As Dr. Bittle mentioned, we have 4 terms per year, 8 weeks per term. The good thing is the faculty has made the courses extremely structured, very organized, so it's relatively easy to be able to plan out your 8 weeks, ahead for the term. So as soon as the course starts, you know exactly what assignments, what readings are due which week, so you can plan your life accordingly. It's also helpful to have your workplace or your team encourage you in your program, particularly because it might help connect the dots. I know for me, it was a huge component of bringing my perspective, my experience from work to many of the discussions and papers during the program. And this brings me to my next point about the importance of thinking relationally. And by relational, I mean it's from the perspective of seeing the commonalities and differences between concepts or even the discussions you may have over the course of the program, because that's where the real power lies, in taking the different ideas and understanding how they are linked, how they might be different, and then be able to apply them based on the situation. I would say equally important would be understanding the association between the different concepts that you may learn and your own experiences. Um, could be what you do at work, could be something you experienced as a patient in the healthcare system. And if you're currently residing outside the US, could even be how you relate the concepts to the healthcare system in your country. So there's great power in linking the concepts you learn with your own experiences and see how they may apply. I'd also like to add a quick note about classes that might be harder than others, because this is different from person to person. Right? What's hard for me might be easy for someone else. What's hard for them might be easy for me. But what I experienced as part of this program was that the hardest classes ended up being amongst my favorite ones. And to me, that that's about being fascinated, right? That about allowing yourself to be curious, allowing yourself to be fascinated by what you learn, what you may discuss with your teams, by what you write for your papers. Because even though we're all learning, we're also exploring ideas. Um, there's so much research and discovery that has been conducted, but there's even more left to do in population health. That's where we must strive to stay fascinated, to take what we learn and bring our own creativity, bring our own unique set of experiences to pave the path forward. And with that, I'd like to thank Dr. Bittle for allowing me to share my experiences of the program. Thanks, Dr. Bittle.
You're welcome. Thank you.
Thank you, Mark, for all the insight into the different parts of the program, and to Hiren for sharing his student experience. I'm now going to take some time to go over the admissions requirements. And if you are interested in moving forward, there are some important things you need to know about the admissions process. All of our applications are processed online through Sophus and Sophus Express to streamline your application. For our master's degree, the application is done through Sophus, and our certificate application is done through Sophus Express. The requirements for education are a minimum of a bachelor's degree from a regionally accredited college or university. The professional requirement is a minimum of 3 years of health-related experience. We do require a current resume or CV to be uploaded into the online portal. The letters of recommendation requirements are 1 for the certificate application and 3 for the master's. The statement of purpose is going to be a big part of your application. This is where you will be able to communicate to the admissions committee why you are pursuing the program, what you hope to gain from it, and what your ultimate career goals are. For our international students, if English is not your first language, you may need an English proficiency exam. We do accept either the TOEFL or the IELTS. For those who have obtained their education outside of the United States, it is a requirement that you undergo a course-by-course credential evaluation via World Education Services. We do encourage you to start this credential evaluation early to gather any required documents and to make sure that the evaluation is done in a timely manner. We are very used to working with students on this at the Office of Admissions. So if this is something you need assistance with or have any questions about, please feel free to reach out and we'll be happy to help with that. Looking over the admissions information, our applications are reviewed on a rolling basis, meaning you do not need to wait until the deadlines posted on this slide to hear back from the committee with your decision. Our applications are now open for the fall of 2021. We do encourage students to apply early so you can receive your decision earlier and start preparing for that upcoming term. The application deadline to apply for the master's is June 1st, and our certificate deadline is July 1st. We are here to assist you throughout the entire application process. If you have any questions or concerns, you have that support system with us. We only enroll once per year, so this is important to know if you're excited about the program and you are ready to apply. To provide insight on the kind of investment you'll be making, we've listed our financial information here, as well as some information about the financial aid office for those who are eligible to utilize other financial resources such as FAFSA. They will be your best resource to connect with on that. For the current school year, the tuition is $1,197 per credit. We do offer a partial OPAL scholarship that covers $460 per credit, which leaves students responsible for the remaining $737 per credit. The scholarship is specific funding to our OPAL programs, which is our online programs of applied learning. If you are admitted into the program, you are automatically awarded that OPAL scholarship. There is nothing additional you will need to do to receive it. So if you are planning financially, you will want to plan for the $737 per credit at the current tuition rate. Of course, keeping in mind that our tuition rate and scholarships are reassessed each spring, and any changes will be updated on our website. And so as promised, we do have time for some Q&A, and I do see a couple questions coming in already. So I'll go ahead and direct these to Dr. Bittle and Hiren. So with the rise of COVID-19, does the population health program speak to the changes this virus has caused to the populations?
Yeah, this is Mark. I think I'll let Hiren speak to that. He mentioned it briefly in his comments, but just how he saw that play out.
Yes, definitely. I would say pretty much a lot of the concepts that we learned during this program speaks directly to both how the pandemic unfolded in many ways, as well as how it impacted populations. So I'll just use a few examples here. Biostatistics. A lot of the things that you learn in biostatistics now that COVID-19 is ongoing, what we learned back then, what I learned back then during the program for biostatistics is very applicable to how the COVID-19 pandemic is unfolding. And on another level, in terms of how it's impacting particular subsets of populations, in terms of social determinants of health, health inequities, structural inequities, those are concepts that are referred to over and over again from different perspectives throughout the course. So I would say the program definitely speaks to that on many levels.
And just to add to that, thank you, Hiren. I wanted to just mention that, again, our course our program is really based on the concept of developing integrated approaches to improving health in a community. I think what we saw in the pandemic, or what the pandemic shined a spotlight on, was how fragmented our approaches are, how little we do truly integrate or collaborate across the various sectors around the topic of health. So as you think about, just for example, the inability of people to get to their doctor's appointments because of the pandemic and people being asked to shelter in place or at home. Part of what we talk about is how do we use payment methodologies to lever changes in care delivery? And we saw that nobody was really in the telehealth space in any large degree prior to COVID. And part of the reason for that is it wasn't paid for. Of course, through some emergency legislation, telehealth became something that was readily paid for and widely adopted as a way to get care out into the community for people who were otherwise unable to come to the care. So all the concepts, many of the concepts that we talk about, a systematic approach, effective collaboration across sectors, leveraging, payment methodologies to align incentives, are all things that we were talking about in the curriculum prior to the pandemic. But once the pandemic hit, a lot of these issues, again, came to light.
Perfect, thank you. How many hours a week would a student have to commit to this program?
I'll start, and then Hiren as the student could weigh in there as well. If you think about the way it works is if a 3-credit class, you can basically assume 9 hours a week for a 3-credit class. And that's sort of just a rough, baseline that we use in our school to identify, being able to, assuming it was an in-person class, the time you would spend in the class. In this case, it's listening to the recorded lectures, readings that you would have to do, working on assignments that you're given in a given week. So the average sort of ballpark is for every 3 credits, you're going to spend 9 hours in a week. So I'm not sure what Hiren's experience was.
I would agree with that as well. I mean, I would say anywhere between 16 to 20 hours. But again, that would depend on the type of course, the number of readings for that particular week, the assignments or group work for that particular week, and to a degree also the comfort level with that particular course. But between 16 and 20 hours for 2 courses during a term.
And I would say that we the faculty, so I teach in first term, and another faculty also teaches the other first term course. We work together to make sure that our assignments aren't all due at the same time. We make sure that our synchronous sessions, our live talks, aren't scheduled for the same evening. So we do a lot to try and coordinate amongst the faculty to assure that our students aren't going to have competing due dates or competing assignments or competing, live talks to attend. So we really do, again, approach the execution of our course and courses to reflect that our students are part-time, they're working professionals, they have families, they have other obligations. So we do our best to organize it so that you're not wasting a lot of time looking for things. We do our best to coordinate due dates. So again, there's not a lot of competition from one class to another. Again, we've tried to do our best to structure it, and we're always, soliciting feedback from our students as we go along to see if there are other things that we can do to enhance the student experience.
Thank you. Can you speak more about the capstone at the end of the program and give a past example?
So the capstone, as we have it currently defined, it may change over time, but the current capstone is a case study that students are given. So it's a standardized case that all students get. So everybody gets the same case. It's an individual project, so of course they have to work on it themselves. But it asks them essentially as a culminating experience to take what they've been taught over the prior 2 years or 4 years, depending on how long it's taken them to complete all the coursework, but to apply the coursework, to apply the concepts, to think about how the concepts apply, how they can be applied in the particular case. The case that we use is a given, is using real data. It's a real county in a real state, and the numbers are real and the issues are real. And so we're asking them to effectively at least the current case, is to develop a population health management strategy along certain elements that we define in the case. So it's not you have to solve every problem, but we give you certain areas that we want you to focus on. But again, it's all based on real data, information that's available, online to support, what's going on is available. You can also, we're expecting that you would pull in evidence from, particularly perhaps what other states are working on as it pertains to some of the issues that have to be addressed. But these are real-time contemporary issues in a real state with real data that you're provided. And the goal is for you to develop a population health management strategy.
Perfect, thank you. Does this program speak to global populations, or is it geared more towards the US population?
I would say, I would answer that with sort of half and half. And I would say that, and I've been to China, I've been to Saudi Arabia. We have students in our program from Canada, Mexico, and the NHS. So, international students are interested in our curriculum. And that, I think, is because the concepts of population health are applicable universally, as I've talked to, people in Saudi Arabia who are interested to, transition immediately to population health. China, the same thing, very much big interest in population health. The concepts are very applicable. The execution, of course, is cultural based, it's norm based. So it allows, though, I think, for the adaptation of those concepts to meet different cultural community needs. The examples, and this is sort of the other 50%, the examples that you're likely to get in the course, in the various courses, are, I would say, pretty much 100% domestic, in the sense that they're focused on the US. But I think we've seen, based on our enrollments of students outside of the US, that the concepts are still very much applicable.
Perfect, thank you. If someone does not have a previous academic background in public health, are there any classes you recommend taking to prepare for the courses in the program?
We do, so I'm one of the admissions committee members, and as we're reviewing applications, one of the things that we look for, and first of all, we're not looking for people that are in healthcare necessarily, although you do have to have some experience with the healthcare system or public health. But one of the things that we do look for is some math experience, exposure. Doesn't have to be recent necessarily, but we do have a number of recommended courses for people to take, and many of which are free, for students to take who haven't had a recent class in biostatistics. Or it's been a while since you've done college algebra. So again, I think overall, the one area that we do want to make sure students are sort of prepared for before they join the program is the ability to be successful in biostatistics. And again, we've worked with our biostatistics faculty to identify these external resources, again, many of which are just free courses that you can take to brush up on those skills. But for the rest of the courses, no, there's nothing that we're really looking for you to have necessarily as a prerequisite.
Perfect, thank you. And to be respectful of everyone's time, this will be our last question for today. Are there any networking opportunities available to students?
Well, I would, if I understand the question, networking opportunities. So there are, and I think Hiren can speak to this as well, but there's a growing number now of alumni from this program that are out there and available to talk to. We obviously, when you're in class, as I say, some classes do have group work, other classes do not. Again, we try and coordinate that across classes in the same term, so that both classes aren't expecting you to do group work. That becomes kind of confusing. But working in the groups is a great way to make connections. I think it's impressed me how the students in our program, albeit virtual, having never met face-to-face, in person, face-to-face, have gotten to know each other, support each other, be there to help study. So some people are not having any issue with biostats. They've created study groups where people just get online together and go through the homework and study for the exams. And so, I think that the networking opportunity just amongst your cohort of students, which typically is anywhere from, I think our smallest was 50 and upwards of 80 in a class. So, many opportunities again across, and these individuals are from across the country, even other countries. And then certainly with the faculty, we're more than willing to get online for virtual office hours, or just one-on-one conversations on the telephone, to just be able to share thoughts about something you're working on, or maybe a job opportunity that you're looking to explore, or just getting some advice in general about coursework, or where to go next after you graduate. So again, I think from a networking perspective, it's alumni, it's current students, as well as faculty.
Would do agree
Perfect.
with that as well, Dr. Bittle. I found that group work was an excellent way to keep in touch with other individuals who are extensively experienced in the healthcare field or healthcare related fields. I still keep in touch with many of my colleagues who are healthcare leaders themselves. And on top of that, faculty members as well, I feel, are extremely helpful in order to make sure that you are connected to resources that you may need. So definitely many opportunities, networking opportunities that would be available to students.
Perfect. Thank you, Dr. Bittle and Hiren. So I thank you all for your attendance. If we didn't get to your questions, we will be connecting with you offline. Our team at the admissions office will contact you directly in the next few days and assist in answering your questions. If you want to connect with someone immediately, my contact information is on the slide here. Feel free to reach out via phone or email. If you are excited about this program and see it as part of your future, please feel free to use the scan codes here to move forward with your application. We do have a dedicated admissions team who is looking forward to working with each and every one of you throughout the entire application process. But with that, thank you again, Dr. Bittle and Hiren, for your time today.
Certainly, my pleasure. Thank you for joining us today.
Thank you.